The novel coronavirus pandemic has unfortunately brought with it a rise in cyber threats to hospitals and health systems. How great is the threat? What is at risk? And what can be done to protect against cyber attacks? Some answers are coming up. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Petterly, Senior Writer with AHA. We are here with John Riggi, Senior Advisor for Cybersecurity and Risk at the American Hospital Association. John retired from the FBI after almost 30 years, completing his service in the FBI's Cyber Division. We're also very privileged to have as our guest today FBI Cyber Division Senior Executive Herb Stapleton. Herb is a former colleague of John's, a highly accomplished FBI veteran with a wide variety of investigative experience, and who currently runs the FBI's National Cyber Criminal Investigations Program. On this podcast, we'll discuss the cyber threat perspective from the field and from the FBI. We'll learn from John about the significant cyber threats and challenges our hospitals are facing and what they're doing to mitigate that risk. Herb will provide us with the FBI's national and global perspective, based on its intelligence about the most significant corona-related cyber threats the nation is facing. He'll discuss what the FBI is doing to counter those threats and assist hospitals. So, John, let's start with you. What are you hearing from the field, and what is your most significant cyber threat concern right now?
Thanks, Tom. Obviously, right now, we're very concerned about any threat which impacts patient care and patient safety, especially now in the context of coronavirus, when hospitals are seeing very increased demand for services. We really believe that, any type of attack which interrupts or interferes with care delivery operations in a hospital is really a threat to public health and safety. And the importance of hospitals, as highlighted now in the coronavirus pandemic, really demonstrates how we all depend upon hospitals to be there and to be functioning. So any of those attacks, we really believe that threat to public health and safety, it's not an economic crime. When you attack a hospital and demand ransomware, that crime crosses a line from an economic crime to really a threat to life crime. We've also seen some denial of service attacks based on even Health and Human Services' main website was attacked and slowed down the functionality of that website. And we've seen in early March, a couple of hospitals suffered some ransomware attacks. Believe they were able to continue services, fortunately. Of course, we are extremely concerned about medical device vulnerabilities, especially concerned about any cyber vulnerabilities which may be present in ventilators or other mission-critical life support devices. We always do recommend to our hospitals to try to ensure those cyber vulnerabilities are patched, and if they can't be patched, to ensure that those devices are off the network or some network segmentation strategies are employed. So lots of concerns, Tom, right now.
Herb, let's turn to you for a minute. Welcome and thank you for joining us today. Given the many different government agencies involved in cybercrime prevention and investigation, perhaps it would be useful for our listeners to understand what the FBI's role is in keeping us safe from cyber attacks. So from the FBI's perspective, could you tell us what types of corona-related cyber threats you're seeing and the types of investigations you're conducting right now?
Yes, certainly, and thanks for having me, Tom. It's good to be on with you today. The FBI really has the lead in threat response for cyber threats all across the country from the federal government perspective, and that includes cyber threats that are related to the coronavirus outbreak. So a couple of things that we have seen over the recent weeks, we've seen at least one ransomware attack on a hospital within the last week. I say at least because we know that not every ransomware attack gets reported to the FBI. And so that's certainly a concern. Much like John said, any type of cyber attack that has the potential to impact life, safety, patient health, that's something that the FBI is going to take very seriously and will be a priority for us from a cyber investigative standpoint. I think John also mentioned the denial of service attacks that we've seen. Again, That's another major concern. Denial of service attacks happen all over the country on a relatively frequent basis. But when that type of attack threatens the networks that we rely on to get information to the public about health concerns, especially in a public health emergency, that's something that we want to be focused on and make sure that we try to help resolve as soon as possible. Lastly, the vast majority of the complaints that we're seeing that are potential corona-related cyber attacks are coronavirus-themed phishing emails or spoofed websites that are designed to either deliver malware or steal personal information.
We can circle back to ransomware attacks for just a minute. There have been a spate of reported attacks, and as you pointed out a moment ago, some of them are not reported. Do you see ransomware as a major ongoing threat to hospitals, or have the bad guys declared a truce and unilaterally decided to stop attacking hospitals, as some in the media have reported?
I want to be really clear about this one. We still see ransomware as a major ongoing threat to businesses, entities, municipalities, governments, and hospitals all across the country. It's really too soon to tell whether there has been any decrease in attacks on hospitals. But as I mentioned, we have definitely gotten reports of ransomware attacks on hospitals since we have been in this coronavirus outbreak situation. So we do know that at least some attacks on hospitals are still going on. And frankly, one ransomware attack on a hospital is one too many from our perspective. And so we still consider that a major threat and a priority for the FBI. I think ransomware attacks that affect first responders, medical facilities, health researchers, those things are all still going on, and all of those things can adversely affect patient care and the health and safety of American citizens. The other thing that's important to point out is that ransomware attacks on other types of entities can have ancillary impacts on hospitals. A ransomware attack on a major supplier of healthcare supplies could impact that supply chain and make it difficult for hospitals to get the equipment or supplies that they need to provide the patients the care that they need.
Yeah, and I was thinking that really the whole idea that bad guys might unilaterally declare a truce, and when the whole point is to profit from a crisis like this, seems rather counterintuitive. So it's a little surprising that kind of reporting would be out there.
I was just going to say the other thing I think is important about that particular news reporting is that even when we aren't in the throes of a coronavirus outbreak, there are many other critically ill patients who need care. And the idea that it's only necessary for criminals to stop attacking hospitals during an outbreak of a virus like this is frankly absurd to me. We need criminals to stop attacking hospitals and all of our entities across the United States altogether. That's what we need them to do, is to agree to stop that type of attack altogether, because when they attack hospitals with ransomware, sick people are being affected whether there is a coronavirus outbreak or not.
John, turning to you for a moment, besides the ransomware attacks, what are some of the other cyber threats, concerns that hospitals are facing, and how have the bad guys been conducting these attacks? What seems to be the pervasive methodology that they're using?
Just going back to Herb's last comments there, Herb, I couldn't agree with you more. Of course, in the FBI, we really believe that a ransomware attack on a hospital or a nursing home, it's an attack on the ill, the infirmed, and the elderly. Really a despicable crime, especially in the height of this crisis, but really despicable at any time. So getting back to your question here, Tom, what else are we saying? Really, as Herb mentioned there, we have seen a dramatic increase in reporting from the field on phishing emails, mainly corona-themed. Click here for the latest coronavirus map update, or emails purporting to be from other government health agencies indicating they need information related to coronavirus. And we see that these phishing emails are being developed either through the penetration of legitimate emails, perhaps where the credentials of the account holder have been compromised, or impersonation of legitimate email accounts. So to do phishing emails to deliver malware or conduct frauds, such as attempting to divert the legitimate payments, or even really in terms of despicable, offering inferior counterfeit medical supplies, which are in dire need. truly something that could directly affect patient care and patient safety when people are desperately in search of these type of supplies, such as the N95 masks. Yet also we're concerned about supply chain risks, that the fact that sophisticated adversaries, maybe even nation states, are intentionally penetrating the supply chain and inserting malware in products or services, or even software updates, which could be used to infect an organization.
Yeah, some of them obviously are so cleverly disguised, it's easy to understand why people do fall for them. Which begs the question, Herb, if I could direct this one to you, if a hospital falls victim to a fraudulent email and they've incurred a financial loss, what should they do? Who should they report it to? And related to that, is there a dollar threshold that should be reported?
So let me start with the second question first and basically say that if a hospital falls victim to some type of phishing scheme or fraudulent email and has lost money, we want reporting about that to law enforcement regardless of the threshold. Part of our job is to take all of these complaints in and aggregate them, understanding that that hospital likely is not the only victim of this particular scheme. And so being able to get the full picture of the scale of that particular activity is really important to us. So a couple of things I would say regarding reporting these types of schemes. The Attorney General has set up a hotline for reporting coronavirus-related schemes specifically, and that's with the National Center for Disaster Fraud. People can find more details on that at the Department of Justice's website, which is justice.gov. In addition to that, if a hospital or really any victim sends money in a fraudulent scheme, particularly a business email compromise type scheme, it's really important to report that information to the victim's financial institution and to the Internet Crime Complaint Center as soon as possible. In many instances, if we know about the transfer of that money soon enough, we may be able to work with our partners to actually recover all or some of that money for the victim. So the quicker we can act in those types of scenarios, the better.
Good to know that the money isn't necessarily gone and that there are avenues to explore if that happens. Last week, the Attorney General advised that those exploiting the coronavirus to conduct frauds and other crimes would be vigorously investigated and prosecuted. Has the FBI prioritized these kinds of crimes, and is the mission or capability of the FBI been impacted by this crisis?
So the FBI is prioritizing these types of crimes, coronavirus-themed crimes, really across the board. The Internet Crime Complaint Center, IC3, is tracking coronavirus-related complaints on a daily basis, culling through that data and finding the information that might provide investigative leads so we can send those out to our field offices for further action. In addition, the FBI's Criminal Investigative Division and the Cyber Division have formed an internal working group to help address this issue to make sure that we're addressing all the various types of crimes that have arisen from this particular coronavirus outbreak. One of the efforts that's underway is to identify and take action to remove coronavirus-themed malicious domains or websites. So earlier this week, the Department of Justice announced the first civil enforcement action against one of these malicious websites in a case that was investigated by the FBI in Austin, Texas. And so this is an effort we're going to continue to focus on to try to identify fraudulent or malicious websites out there and remove those before they have an opportunity to cause too much damage. Your last question, I think, or your last part of your question was about how this has affected the FBI's mission or capabilities. And I'll say that the people of the FBI are tough and resilient and dedicated. And so while we've had to make some adjustments like everyone else to ensure we're minimizing risk of spreading the virus, we won't allow anything to prevent us from accomplishing our mission to protect the American people and uphold the Constitution.
Quick follow-up on I was just thinking you made an interesting point. Malicious websites seem to be like whack-a-mole. You knock one down and another one pops up. Is it difficult to keep pace? You may put one out of business, and is it so easy for these things to just spring into existence that it's more a matter of just trying to contain them rather than stamp them out entirely?
Well, it would be extremely difficult to completely eliminate all malicious domains. I think in a situation like this, over the short term, we can have an impact in trying to eliminate those domains in a sort of crisis situation like this. I've just seen a lot of these pop up. And so by working with private sector partners and applying some analytics to this, the hope is that we can knock some of these malicious domains out before they really have a chance to take hold. But we definitely recognize the possibility that other ones can pop up. But my response to that is, we'll continue to work tirelessly to try to impact those particular domains. And over the long term, there's really a short-term view and a long-term view. And so in the short term, it's important to try to eliminate the ones that we can identify. Over the long term, the FBI conducts larger scale investigations into the enterprises that are behind these types of activities, ultimately to identify the people behind the keyboards and bring them to justice. So reporting to the IC3 is easy. All a victim has to do to report some kind of scheme or fraud to the IC3 is go to ic3.gov and fill out the complaint form. So that's www.ic3.gov. And then just to emphasize, prompt reporting is really important to have any opportunity to recover victims' funds before they're lost. Reporting within the first 72 hours after a victim has suffered a loss is really critical.
Great, thank you. John, what are some of the other concerns or cyber risks to hospitals created by this unprecedented time we live in, this stay-at-home social distancing guidelines that we are all living under right now?
Well, Tom, you can imagine that to reduce the risk of infection, non-clinical staff, many non-clinical staff have been asked to conduct their work remotely, telework in. So immediately that raises the risk of potential virtual private network vulnerabilities, VPN vulnerabilities, which is the way that most people will connect back into their home networks. They are supposed to be encrypted, pretty secure, but I am concerned that some recent government bulletins that were issued towards the end of last year and the beginning of this year highlighted vulnerabilities in very significant, well-known VPN services. The bulletins are not actually for broad public distribution. They are located on our website behind the member wall for folks that want to get in there and take a look at them. And they also contain indicators of compromise, which would be very useful for our hospitals to understand what those IOCs, as we call them, and have those vulnerabilities corrected. Also the other issue, which is really a great innovation, is telemedicine. So great innovation, absolutely necessary, especially in the context of the coronavirus, to deliver remote care. And absolutely must expand. It improves patient outcomes, and we see how useful it is. However, telemedicine does potentially encumber some risk. In fact, in that it may be susceptible to compromising patient privacy if those networks, that telehealth system is somehow vulnerable or is not encrypted. And if it's not configured correctly, telemedicine type devices may be connecting back into the main networks, which could pose a potential route or access for the bad guys. So last week, HHS issued some waivers for telemedicine privacy and security from some of their privacy and security rules, but it is not, and we want to emphasize this, not a blanket waiver. They are still looking at hospitals conducting telehealth in good faith using end-to-end encrypted type services such as FaceTime and Skype. So those are the main issues we're concerned right now in this new world of the coronavirus, remote telework and social distancing.
Thank you for a great answer, John. That I think lends a lot of insight into what we're dealing with right now. Herb, we've discussed a number of ways in which the FBI is working very hard to assist and protect hospitals. So from the hospital's end, from their end, what can they do to work proactively with the FBI during this crisis to avert these threats?
So, we often think of cyber threats being targeted toward networks and hardware and software, but in large part, cyber attacks are really targeted at people. They really are looking often to exploit vulnerabilities in the people who touch our and access our networks in order to gain, some type of access or deliver, their malware onto a network. And so the reason I say that is, hospitals have a critical mission to fulfill during this public health emergency. And I know that the people who are out there working on the front lines, employees of hospitals across the country, are tired and stressed. And so I think the way to proactively work with the FBI here is to stay on your guard and maintain that heightened awareness about cyber threats, to be on the lookout for the things that cyber criminals try to use to exploit us, social engineering techniques like phishing emails, to be cautious about links in emails that from sources you don't recognize, or things that just seem out of the ordinary. I know that's a lot to ask when there's so much else on the plates of hospital employees and healthcare providers across the country, but I think that's really the best way to do it, is to practice that good cybersecurity and that good cyber hygiene, even in these very high-stress times. The most important thing that hospitals can do is to have that heightened awareness about ways they can be targeted. If people who work at the hospital see suspicious cyber activity, to contact the FBI right away. We'll take it from there so the hospital can get back to the business of saving lives.
Well, we are just about towards the end of the podcast here. So, John, do you have any closing thoughts as we wrap up the discussion?
I'd like to thank you, Tom, and thank you, Herb, for all the great work that you and the FBI are doing to keep us cyber safe. I'd like to also acknowledge that we're all well aware it's not just cyber threats facing hospitals, unfortunately. We at the American Hospital Association would like to thank the men and women of the FBI for interrupting the planned attack on a Missouri hospital this week, which resulted in a gun battle between the suspect and the FBI. It's nice to know the FBI has our back and willing to go into harm's way to protect all the doctors, nurses, and staff who are in harm's way, caring for the nation's coronavirus patients.
Amen to that. And Herb, you get the last word of our conversation today. Any thoughts you'd like to share with our listeners as we wrap up?
Thanks, Tom, and thank you, John, for having a conversation and including the FBI in this really important discussion today. I just want to say the men and women of the FBI have tremendous respect for the work done by our healthcare professionals across the country. And we thank them for what they do, not only in times of crisis, but every single day of the year. At FBI Cyber, our goal is to keep hospitals safe and secure in a digitally connected world so that they can focus on keeping us all healthy. Thanks again for having me on.
And thank you both again for sharing such important information and insight on the critical issue of cybersecurity during this time of crisis. You've been listening to FBI Cyber Division Senior Executive Herb Stapleton and John Riggi, a former FBI colleague of Herb's, who now serves as Senior Advisor for Cybersecurity and Risk at the AHA. This is Advancing Health, a podcast from the American Hospital Association.